Hi, my name is Dr. Jeff Terrell. I'm an otolaryngologist at the University of Michigan. I specialize in rhinology. I see patients every week in clinic that are being assessed for whether they need sinus surgery or for the medical management of sinus diseases. And I see a lot of patients that need sinus surgery, and frankly, I see a lot of patients that don't need sinus surgery, and then also patients that have had sinus surgery that probably didn't need sinus surgery. So I've written a blog on one website called nosesinusallergy.com, but I think I wanted to make a YouTube video on it as well. And the topic for today is 10 good reasons to have sinus surgery. And if you tune in, I hope to very soon make a video which may be more interesting to some of you, which is 10 reasons not to have sinus surgery. So I'm going to start off with number 10, and which may be less common, and then work up to number 1, which may be one of the more common reasons to have sinus surgery. Sinus surgery, also called endoscopic sinus surgery now, because we work with instruments through the nose. So it's a small fiber optic scope, 4 millimeters. It's attached to a camera, and I can include some photos in this video as well that I'll overlay my talk. But one of the reasons to have sinus surgery, my number 10, is recurring sinus infections in patients with an impaired immune system. So first of all, what's an impaired immune system? There are these biologic drugs you hear on TV now, Humira for rheumatoid arthritis or psoriasis, other drugs that suppress the immune system for people that have autoimmune disorders. Unfortunately, those drugs also suppress your ability to fight infections, and so some people on these immune modulators or biologic drugs will get sinus infections, and they have a hard time clearing the sinus infection. Oftentimes, we have patients stop their biologic drug to see if their immune system can clear the infection. But if it doesn't, we sometimes treat these patients with surgery to open the sinuses. Another cause for sinus surgery, a reason for sinus surgery, number 9 in my list, is nasal polyps and severe allergies. These are patients without asthma and nasal polyps. They have severe allergies, and they'll get a nasal polyp. And a polyp is, I liken it to like a grape. It's a swollen, watery tissue that hangs from the tissues in the nose. There are things called turbinates in the nose. Polyps can form on these turbinates and sometimes block the nose. Not real commonly. We sometimes even do that in the office if it's just one polyp in the nose blocking things. I do that quite commonly. But this is just people with allergies and polyps, and I want to make sure that's different from people with nasal polyps and asthma. It's a different group. Why don't we do that now? Number 8 is triad asthma. Triad asthma is, there are 3 things in the triad. It's usually adult onset asthma, nasal polyps, and aspirin or Motrin sensitivity. So these are patients that frequently are quite healthy, and they develop some nasal obstruction, oftentimes first. Then they may have a decreased sense of smell, and these are the polyps that are forming in the nose, and then these patients will develop asthma. So that's the polyps and the asthma. The third thing is aspirin sensitivity. So one day these patients will take aspirin or Motrin or a non-steroidal anti-inflammatory drug, and that will cause them to have an asthma attack, sometimes quite severe. So if you have nasal polyps, asthma, and aspirin sensitivity, and the nasal polyps are quite large, that's a common reason for sinus surgery, at least in Michigan, and some areas of the country have more or less, but that's a common reason for sinus surgery. Those patients, oftentimes their nose is completely obstructed with polyps. Number 7 is called an antrochoanal polyp. There's the maxillary sinus. It's called the antrum. Sometimes a large cyst will form in a sinus. It'll fall into the nose. It's called an antrochoanal polyp when it blocks up the nose. These are not very common, but it's an absolute indication for surgery because people are pretty miserable when the polyp blocks one nose. Number 5 would be a fungus ball. It's not very common, but occasionally people can inhale some mold or fungus. They can get trapped in the sinuses. When we look at CT scans, we can oftentimes see the fungus. It looks different. It looks a lighter color gray in the sinuses. I can see if I can add a photo of that. The fungus oftentimes gets trapped in the sinus. The sinus has a very small opening, the fungus ball is larger than the opening, that's again typically an absolute indication, a very reasonable indication to do sinus surgery, because the fungus won't come out through a small opening. Similarly, there's something called allergic fungal sinusitis. So this is fungus that gets in the sinus, but then you get this incredible inflammatory or allergic response to it. That causes nasal polyps, and either the fungus or the polyps can actually push bone and erode bone and thin bone. So sometimes it pushes towards the eye or pushes out the eye or pushes backwards towards the brain. Again, CT scan and an ENT doctor that is somewhat experienced should recognize this. Sometimes they don't, but this is allergic fungal sinusitis. And we see this because there's areas of a lighter color fungus. The nose gets plugged up with polyps, and you see the nasal polyps in the CT scan, and some expansion and erosion of the walls. So that's allergic fungal sinusitis. That's number 4. Number 3, if there's a foreign body in the sinuses that keeps getting infected. Again, this is not very common, but it's almost an absolute indication. Some people have jaw surgery, trauma, plates, pieces of plastic. Sometimes a tooth fragment will be pushed up into the sinus. And when that sits in the sinus, it forms kind of like a splinter or a foreign body. It keeps getting infected. And so this is not very common, but when it does occur, it usually is something that needs surgery to get out that foreign body. Recurring sinus infections that don't clear with antibiotics is another common cause for needing sinus surgery. Number 2 on my list. And actually, I think most of the time when people have recurring sinus infections, it's either due to allergies or they're just exposed to, I call it germ warfare. They get a lot of colds. Those are the 2 most common causes. Usually if you treat the allergies or try to avoid getting colds by hand washing and those sort of things, usually you can avoid doing sinus surgery. But occasionally people do get recurring sinus infections. I tell them to watch out for a tooth abscess that can cause sinus infection. It's not on my list, but whenever anybody gets a recurring sinus infection, particularly in this sinus, we do look for an abscessed tooth. Probably should be my number 11 on the list. So that was number 2. Number 1 is chronic bacterial sinus infections that have failed all medical interventions. So by that I mean somebody that's had 2 or 3 courses of antibiotics, and the infection with a yellow-green nasal discharge, a nasal blockage, maybe some pressure, keeps coming back or never improves. Oftentimes in the clinic we'll culture these patients to find the best antibiotic, but even the best antibiotic sometimes doesn't work, and the sinus needs to be opened and drained. We see this with dental infections as well, when the tooth root gets infected, and then the sinus gets infected, and it's hard to clear some of those infections. Sometimes the sinus fills up with very thick, pus actually, and it's so thick and sticky it just can't work its way out. It just keeps getting infected, kind of like an abscess. And to treat an abscess in the skin or anywhere else in the body, first you have to open it up and drain it. In the sinus we wash it out and then treat it with antibiotics. So those are the top 10 reasons for sinus surgery. I hope you'll consider tuning in, because probably as many of you need to know the top 10 reasons to not have sinus surgery.